Welcome to Dentists Behaving Badly. I'm Dr. Tony, a dentist who has been in practice for over 20 years. I'm selecting articles from the internet of instances of dentists who have made the news for acting up and others who have found themselves in bad situations. Sometimes good intentions turn into something bad. Other times, the intentions were bad from the beginning. The link to the source article for today's story can be found in the description box. Also, I'm not trying to embarrass anyone, so I only use the initials of the accused in the video. The identity of the accused can be found in the source article. Today's story is found on WIFR 23 out of Springfield, Illinois, published on February 9th, 2022. Illinois dentist accused of diverting patient's anesthesia drug for personal use. An Illinois dentist is charged with tampering with his patient's anesthesia drugs in order to steal fentanyl for his own personal use. Dr. PJ, 61, was arrested Monday on 8 counts of drug diversion, 8 counts of obtaining a controlled substance by fraud, 1 count of tampering with consumer products, and 3 counts of false statements related to healthcare matters. A federal grand jury indictment claims as early as December 2019 and continuing through at least August of 2020, prior to patient's oral surgery, he would pierce the fentanyl vials supposed to be used as anesthesia, remove half of the drug to set aside for himself, refill the vial with another solution, and then give the diluted medication, now only half strength, to his patients. This dentist is authorized by the Drug Enforcement Administration to dispense controlled substances. However, if convicted, the charges carry a maximum sentence of between 4 and 20 years in prison. This dentist clearly has an substance abuse problem, and I hope that this doctor can get the help that he needs and become rehabilitated so he can live the life that he really wants to live instead of living the way that he has been, stealing medication from his patients and giving them half doses. It's unfortunate for everyone involved. It's unfortunate most of all for the patients, but also the doctor putting himself in a situation like this as a result of a substance abuse addiction. I definitely sympathize with all of the people involved. Dentists are perfectionists who work in small spaces and in small increments under extreme stress. This personality type, coupled with the stress of practicing dentistry in addition to the balance of personal life, can wreak havoc on a person's psyche, which is why it's not uncommon to see substance abuse issues among dentists. It saddens me. It's unfortunate for everyone involved, and it affects not only just the dentist, it affects their families. It most of all affects the quality of care. It's just sad. Like I said, I hope this dentist get the help that he needs. Most dentists endeavor daily to use their skills, talents, and social standing as doctors to provide outstanding care to their patients and serve as role models in the community. A small group of dentists allow entitlement, greed, and personal proclivities to overshadow their responsibility to their patients, the profession, and society.